This is U.S. Senator and Dr. Bill Cassidy saying that we have to flatten that coronavirus curve if we are going to save people's lives. When someone gets infected, they can infect 2 to 3 other people, and each of these infects 2 to 3 more. At first, cases accumulate slowly, then they build rapidly, and then the number of cases explodes. We don't want that to happen. If there's a rapid increase in COVID-19 cases, as shown by the orange bell-shaped curve, and a limited number of hospital beds, as shown by the purple line, the beds fill up rapidly, quickly there are too many patients, and then the system is overwhelmed. More patients die than have to because all the hospital beds are full. Slowing the increase in the number of cases to flatten the curve means that the number of COVID-19 cases increases over several months instead of several weeks. This allows the same number of hospital beds to adequately treat the number of patients. More people live because they have the resources they need.